picked it up and jammed it back in, but the pupil was on the other side. Okay, just got a little headache.
Excess skin, freaky eye issues, and it's definitely not a tumor.
It's not a tumor.
Get ready to laugh because today we're breaking down and reacting to one of my faves, the most outrageous medical scenes and absurd injuries from Family Guy. Let's dive right in.
All right, that's it. We got to do something about this. We have got to get that record and destroy it.
We got loud, weird music playing, and Stewie starts having a nosebleed. Could that happen? Probably not. If you start having a nosebleed, pinch your nostrils in the front and lean forward.
Just like that fat person's surgery destroyed Star Jones's arms.
I look so good. I lost all this weight. Taxi! Coming to show the people how good I look.
Sometimes with different types of bariatric surgeries for weight loss, the weight loss is so fast that the skin that has been stretched out to hold that weight doesn't have enough time to slowly regress back.
Meg, oh my God, it's crazy here. Dad fell off the pole and landed on his head, and one of his eyes popped out. We picked it up and jammed it back in, but the pupil was on the other side. Okay, just got a little headache.
That would be a good treatment potentially for if a tooth falls out. Really difficult to put an eyeball back in, especially if it's totally out and you don't have the connections anymore. Remember, the eyeball has 6 muscles plus the attachment of the optic nerve, so there's 7 different attachments.
Just got a little headache. Also, Dad gave me a hard lemonade. He's pretty out of it.
You saw the redness around the white of the eye. The white of the eye is called the sclera, and when you have that redness in those blood vessels that are a little bit more fiery, we call that injection.
I have found you!
Oh my gosh! We have a single bullet injury. It's obviously a through and through to the shoulder. Unlikely that it hit the bone because the bone would likely change the trajectory of the bullet if it's going through and through versus just through the soft tissue. What the? Hit Meg in the head, directly in the forehead, through the skull, into the brain tissue. Somebody gets a bullet shot to the head. Doesn't necessarily mean they succumb to the injury. Call 911 right away.
Quick, somebody call an ambulance. This could need stitches. We don't want this to leave a scar.
No, there's no time for an ambulance. We gotta take him to the hospital right away.
I think the smarter thing would be to call an ambulance because most of the time, at least here in the United States, an ambulance will get to you between 2 and 5 minutes. It's pretty darn fast. God forbid there's something happens along the way to the hospital. At least if you're in the back of the ambulance, they can do something.
Guys, I'm all right. I think Meg...
Oh my God, he's delirious. He's talking nonsense. Quick, everybody in the car.
That's so messed up. In Meg's case, you worry about airway compromise, so you probably intubate the individual, especially if they are still breathing and they still have a pulse. You want to control that because you're worried about brain swelling and the possibility of losing an airway.
Sir, I think you should know these growths on your forearms. They're giant tumors.
Oh my gosh, it's Popeye. But it's funny that he's always known for these big, huge forearms. Tumors don't present this way. The tumors would be probably asymmetrical and they wouldn't be bilateral like that.
And the speech thing and what you're doing with your eye? You had a stroke about 7 years ago.
Typically, a stroke would spare the ability to lift your eyebrow. So if somebody comes in and they can't lift their eyebrow on the same side where they're having a facial droop, the likelihood is that they are having Bell's palsy.
That you've managed to be walking around all this time is nothing short of a miracle. I'd say about 2 months.
If somebody in your life has stroke-like symptoms, get them to the hospital ASAP. Within a 3-hour window of the onset of symptoms, or 4.5 depending on certain criteria, we can give a medication systemically in an IV that will break up a clot that might be causing this.
Oh, Peter.
Oh, Lois, I missed you. You and your wonderful smile and your beautiful eyes and your awesome third boob that's on top of the other boob.
What?
What?
Oh my God. Peter, that's not a boob. That's a lump.
It's really important to do breast exams, feel your tissue and make sure that you're not feeling any abnormalities. You should be doing this in the shower. You're palpating and then going out in a circular fashion to hit the whole breast so you don't miss any area.
Mrs. Griffin, I've got good news. Your test results came back negative.
People will come to the emergency department immediately to get evaluated. You can do an ultrasound to make sure that there's no sign of like an abscess, but you need a mammogram. And then after the mammogram, if there's a lump in that area, then you're going to potentially need a fine needle biopsy or potentially a little bit larger biopsy.
It appears the lump in your breast is not black gross boob death.
Breast cancer?
That's the layman's term, yes.
Oh, thank God.
Black gross boob death is not a current medical term that we use. We'll say cancer, tumors, mass in a cancer diagnosis rule out situation. You just want to be straightforward. You don't want to try to be funny.
What a relief.
Yeah, that was scary.
If you find yourself in a situation like this where you're facing the occasional stresses, I want you to check out my formulated supplement called Chillax to help calm the body and the mind to bring those chill vibes.
Now, Mrs. Griffin, although you're in the clear for the moment, we need to have a look at your family medical history to determine your future risk.
Family histories are very important. We ask about family histories because we want to know, is there increased risk? Are there anybody else in the family that died of different types of cancers or that specific type of cancer that you're worried about? Oh! I didn't count how many bullets went through the thorax, but a lot. Now, I've been in situations where somebody has gotten a lot of bullets into the chest and they actually survive versus one. It actually does depend on where it actually hits and what major vessels and organs it's missing. Oh my gosh, still breathing, still alive? If somebody were to have penetrating trauma and then lose pulses, you end up doing a thoracotomy where you basically crack open the chest and see if you can get to the heart and see if there's any damage to the heart itself, such as like a hole through the heart, and then you repair it immediately. A bullet to the brain, again, if it goes straight through, missing certain structures of the brain, you could potentially still be alive. It, again, depends on the area.
Oh my God. Where am I? What happened?
Oof, coma breath.
Coma?
People do wake up randomly from being in a coma, so his airway was protected, didn't need a breathing tube or oxygen, but he was not waking up and then randomly woke up. This does occasionally happen.
Can I go home?
Well, you're not really ready, but if it's for revenge, you can stab me with this scalpel and then run out.
There are different types of scalpels out there. We use different types of blades on the top of these scalpels. And the most common instruments that we use in the emergency department is an 11 blade, a 15 blade, or a 10 blade. The 11 blade is the most common in the emergency department because it's pointy and straight.
Thanks.
What?
Oh, that was unnecessary, but cool.
Peter jumps out of the bed after being in a coma. The likelihood of being able to do that is pretty low because you're going to have atrophy of your muscles. Your strength is going to be very low, and your ability to just jump and run is going to be significantly decreased, and he probably would fall and hurt himself on the floor.
So awesome.
What? That amount of trauma to your eye, call the ophthalmologist, try to prevent any touching of the eye because it increases all the fluid coming out. You'd actually want to put like a cup or a shield over your eye if there's actually eye trauma and get to the hospital ASAP. Family Guy, holy cow, I feel like I'm a Family Guy medical trauma expert. But again, there's so many clips and so many scenes in Family Guy that actually have medical components, and it's quite entertaining to me, so I really enjoy this. There's plenty more. Check out this playlist right here, binge watch everything. And as always, do me a favor, subscribe, turn your bell notifications on, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.